coming to background, persistent ventricular dysfunction is commonly reported in Alcapa after repair, even after repair, which is commonly attributed to the hypoperfusion of the myocardium. And this hypoperfusion, which is resulted secondary to the coronary still, which not only affects the subendocardial layers as shown in this gross pathological specimen of post-operative patient, it also extends into the myocardial, endocardial, mid-myocardial and epicardial layers as well. This was documented not only in MRI and MRI-based studies even in normalized LV function post-operatively. These ventricular strain abnormalities also reported in these patients of post-operative Alcapa patients. So far, no study is there which looks after these strain abnormalities whether they are correlating with the clinical outcomes as well. So we aimed at looking at assessment and patterns of the strain abnormalities in these post-operative Alcapa patients. And we also aimed to find any correlation between this abnormal strain and clinical outcomes, and to look for any predictors of these strain abnormalities, and particularly whether age of repair is affecting these strain abnormalities on follow. So the framework of studies, preoperative and perioperative details of all Alcapa patients were collected from the electronic medical records. And since the Alcapa is a very rare congenital disease with incidence of 1 in 3 lakh population, by using modified Cochrane's equation, which is corrected to the sample size, we estimated the sample size was 52 with a precision level of 5%. All patients were prospectively called. Detailed echo and strain imaging was done. So this is the study protocol. We excluded the patients who underwent Alcapa repair elsewhere, which contributes to only 2 patients with insufficient data, and those who have significant other heart disease that can color the strain value also we excluded. All consecutive patients we included, and the total number recruited in this study was 59. And strain imaging was done by single operated blinded fashion in EPIC machine. And these are the results. Median age of diagnosis is 5 months, and median time duration from the diagnosis to surgery is 12 hours. And the female to male ratio is 1.26, and median follow-up duration of 7.4 years. So coming to my primary outcomes, mean global longitudinal strain of LV is 18, and mean circumferential strain was 25, mean RCA territory strain was 18, and mean LCA territory strain was 17, which were significantly lower when compared to the normal age-related strain cutoffs. Though secondary outcomes are less, 2 patients had heart failure post-operatively, and 1 patient had VT, which was successfully managed. So these are we tried to analyze the predictors of strain. By univariate model, translocation distance and coronary originating from the non-facing sinus, and ejection fraction on follow-up, and inotrope Rs, composite secondary outcomes were known to have significantly predicting the abnormal strain. But none of these variables are showing prediction of abnormality in multivariate regression analysis. So then we proceeded analyzing the correlating the ejection fraction and strain. In all 59 patients, almost 83% of the patients have normalized ejection fraction on follow, but significant amount of 40% of the patients still have abnormal strain despite of the normalization of ejection fraction. So then, basing on this, we taken all the normalized LV function group, and we tried to analyze the age of repair, whether there is any correlation with this age of repair. And to exclude the confounding variables for the strain, we excluded the patients like more than moderate MR, which can decrease the strain. So finally, we included for this analysis 39 patients. A ROC curve was analyzed by plotting age of repair as a continuous variable, and normalization of strain as categorical variable, and divided. It gave a cutoff of 7.8 months with a AUC of 82%, which is a good sensitivity and specificity, with dividing into late and early repair. As you see in early repair group, almost 81% of the patients has normalized strain, whereas in late repair group, 67% of patients have abnormal strain. So probability of normalization if surgery was done early is 81%, and odds of better outcome is 11 times higher if the surgery was done before 7.8 months. So none of the other strain parameters like circumferential strain, regional strains were significant except for the longitudinal strain. So we have noted interesting findings like even the patients have RCA territory strain abnormalities. Though Alcapa is called as left system abnormality, and post-operatively we found significant strain abnormalities which can be mild to severe strain in RCA territories as well. So coming to STEN-SAHA study, it's the first study to look at the age of repair and presence of, and predictors of other strain abnormalities. Limitations being we used a meta-analysis data for age and vendor-specific normalized data. MRI may be needed for validation. So this is what this study adds extra to this literature. Despite the normalization of strain, LV function, strain abnormalities do exist in sizable population of the Alcapa, which needs a long-term follow-up. and there is no significant correlation between abnormal GLS and secondary outcomes. RCA territory also showed some strain abnormalities, and early the repair will decrease the chance of strain abnormalities on follow. Thank you.